Hello, my name is Dr. Patel, and I'm co-medical director here at Highlands Rehab Hospital in El Paso, Texas, a part of the Vibra healthcare system. And May is National Stroke Awareness Month, so we're going to talk about stroke awareness. First things first, it's important to recognize the signs and symptoms of stroke so that you can act quickly, and the acronym to remember for that is FAST. So what does that stand for? So F stands for face drooping, A stands for arm weakness, S for speech difficulty, and T, time to call for help if someone is having a stroke. So these symptoms are really important. Other symptoms that you could be having is numbness, especially on one side of the body, as well as confusion or difficulty understanding people. You might have difficulty with balance, dizziness, or unexplained headache. If you experience any of these symptoms, it's really important to call 911 right away, or if you're unable to, ask somebody to call 911 for you. If not, you can always just call 911, leave it on, and they'll still send somebody to help you. The reason it's important to act quickly is because time is brain matter. The quicker you respond, there's more things that sometimes doctors are able to do to help facilitate recovery, such that you can have quicker medical help and lessen the risk of serious disability and frailty. Stroke's actually one of the leading causes for long-term disability in patients. Affects actually 795,000 people a year in the United States. And it can actually lead to some disabilities that we can actually help with. And so it's important to get appropriate medical care so that we can help provide you with more functional way to exist after these events. And here at Highlands, we focus on doing that with an interdisciplinary team we put together, which includes a big team of therapists, including physical therapists, occupational therapists, speech therapists, as well as case managers to help with coordination of care and equipment, and so much more. Other things to know about stroke is that it's important for prevention. So things that you can't change is as you get older, unfortunately, we're all going to be at a higher risk of stroke. However, did you know you can actually do things yourself to lessen the risk of stroke? I know, that's amazing, right? So things you can do is, if you're smoking, stop smoking. This definitely does increase your risk for stroke. And one of the biggest risk factors is actually having high blood pressure. So if you do have high blood pressure, making sure you're eating a salt-free diet and making sure that you're following your doctor's recommendations for your medications and keeping that under control, it's very important. If you have diabetes, that also puts you at a higher risk. Sometimes if you have specific heart conditions and arrhythmias, such as something called atrial fibrillation or an irregular heartbeat, that does put you at an increased risk of stroke as well. Your doctor may consider putting you on a blood thinner in that situation, and then it's of course very important to follow your doctor's recommendations. But along with prevention, if you do again have these symptoms of strokes, just remember, act